Welcome to Breakaway Chiropractic, where we help you on your journey to higher health. 80% of people deal with low back pain at least at some point in their life. And a lot of things are fixable issues. And a lot of things actually stem from the things that we do on a daily basis. Kind of the way that we stand, the way that we sit, the way that we lay. There's so many different culprits that lead to the low back pain that we deal with, and there's a lot of ways to fix it. One of the most common diagnoses that occur that lead to people's low back pain is something called the anterior pelvic tilt. So when you stand, most people stand like this. So what that does is it tightens our low back, tightens our glutes, tightens our psoas muscles or your main hip flexors, and it weakens our lower core and our abdomen. So if we tighten up that core, pulling from our lower abdomen and rotating our hips forward, that's gonna take a ton of pressure off of our spine to begin with. If you're feeling any of those things, here's what to do. Here's the 3 fastest things that you can do to help with the pain that you're dealing with. First one is gonna be a psoas stretch going into a lunge. So we're gonna go 90 degrees right through here with our leg, and we're gonna push our hips forward. Notice how my knee is not going over my toe, but we're gonna feel a nice stretch right through here into this psoas muscle. This psoas muscle, or the main hip flexor, starts at L1 or L2, and it comes all the way down to our pubic bone. This muscle, when it tightens up, it'll pull so hard that it pulls our pelvis forward. So we're gonna do this for 30 seconds, 3 times on each side. Next one, what we're gonna do is we're gonna get up onto the floor, and we're gonna go into a pelvic tilt. So you're gonna feel that arch in your low back, but we are gonna tilt our pelvis, kind of like we're thrusting, and we're gonna tilt, pulling from our lower core, and relax. Tilt and relax. One way to make sure that you're doing it correctly, slide your hand underneath your low back, feel that arch, and pull your hips forward, and you're gonna be pushing that low back into the mat or into the table, wherever you're doing this, okay? You wanna do that 3 sets, work your way up to 20 reps for each set. The next one we're gonna do is a bridge. Pushing through our heels, we're gonna push up, squeeze through our glutes. Notice how I'm nice and vertical through here. Everything is a nice straight line. Once again, we're gonna go for 3 sets, 20 reps. If you can only do 10 and 10 proper ones, I'd rather have you do that than getting them to 20. In all honesty, if you've tried these exercises for 2 weeks and you've done them 3 or 4 times a week for the last 2 weeks and your pain is still not getting better, or even if you're dealing with radiating, numbness, or tingling, or any of those things, be sure to see a chiropractor. And if you're in our city, we're located in North Frisco, we'd love to help you out. If you have any other questions, please feel free to comment below, or if there's any other videos that you want to see, subscribe and let us know what you want to see.